Hi, this is Dr. Eduardo del Río, and I'm going to talk about how to make a right side LV lead implant easy. I have no conflict of interest to declare, and I want to start with this slide. And I am representing uh, this table position. So this table position will be the position for the regular devices. Okay, but this table position has several issues. Um, this represents the catheter, and I wanted to see that this catheter over here is kink in this position. Also, catheters and guide wires may fall off the table with this position, and the torque control is not the best with this table position. So this will be the correct position for left-sided implants. So having your table parallel to the patient's table improves ergonomics and improves catheter control and improves the torque control, and also catheters may not fall the floor. Now, one may think that this is the correct position for implant a device from the right, but it is not, because you have to remember that by facing the patient's feet, your muscle memory is exactly the same as in the left side. Also, it's very important that your table is at the same height as the patient's table. Next step, you will have to advance a guide wire into the right ventricle, right here. And then you will have to advance a standard Worley sheath over the dilator. And now you will have to leave the tip of the sheath exactly in the SBC right atrium junction. Now you will have to hand shape a multi-purpose guide catheter in order to resemble the braided core of the Worley sheath. To do this, you may use this Boston Scientific Mag 1 MP2 guide catheter. It has a 6 French internal diameter. There's other catheters you may use, as the AL2 guide catheter or the launcher guiding catheter. All of these catheters are 6 French in diameter. So this video right here show you how to shape the catheter. As you may see, you will have to start over here, and then you have to go all the way with your fingers to the tip to get this this shape. Now this is your injection system, and you will have to connect your multi-purpose MP2 guide catheter to your injection system. Once you have your injection system connected, now you will need to advance your MP2 catheter to the right ventricle. And then you will have to do a counterclockwise rotation, and you will have to pull back the catheter with counterclockwise rotation in order to get into the coronary sinus. In this step, you can make some contrast puff to see where you are and to see if you already are inside the coronary sinus. Once you are inside the coronary sinus with your MP2 multipurpose catheter, now you will need to advance a 180 centimeter 035 glide wire all the way into the coronary sinus. Now, this video over here show you this is the glide wire, and this is your multipurpose catheter advancing as far as possible into the coronary sinus. Once you have your MP2 catheter in place, now you will need to advance your Worley sheath. But in order to do that, you will need support. And in order to get that, now you will have to add an implant wire all the way inside the coronary sinus. And it's very important that the implant wire, it's a short taper J-tip implant wire. This is important because the standard implant wire has a floppy tip in this portion that is outside the catheter, and it will not provide the support you needed for this particular step. Remember, when advancing the implant wire, you may need to trap the glide wire to avoid this glide wire goes far inside the coronary sinus. Now you have your implants and your glide wire inside, and sometimes things can be really difficult to advance the Worley sheath, and in these cases you may need to add a second implant for extra support to get your Worley sheath all the way into the coronary sinus. So now, at this point, do not remove the implant wire. You will have to remove your multipurpose guide catheter, and you have to remove the glide wire. Remember that it's important to stabilize the wire by clipping into the drape or in the table with a clamp. When you're here, you may perform an occlusive venogram to choose your target vein. In this particular example, the target vein will be this one over here. And I want you to see that the implant guide wire is still in place. Now, you can advance a subselector, and you may perform an occlusive selective venogram at this point, and you may advance a vein selector. Now you will have to advance your LB lead, and once you have the LB lead in place, now you have to do some tests, and if you're happy with the numbers you get, now you have to put a soft stylet all the way to the tip of the LB leaf. Once you have your stylet all the way to the tip of the LB leaf, now you will have to remove your whirly sheet. And then you will have to remove your implant wire. Once you have removed your implant wire, now you have to remove the soft stylet. But it's important that you will have to do it quickly. And that's it. I hope you enjoyed this presentation. Thank you so much.